Do you feel itchy and uncomfortable down there? Is your vaginal discharge unusual or has a foul smell? Be careful, this could be an early warning sign of a yeast infection, a condition that seems simple but can recur and seriously affect your quality of life, especially in older women. Ignoring these signs could lead to chronic issues or even dangerous complications. Welcome to Health First 365, your trusted YouTube channel for practical, science-backed health information, especially for seniors and anyone who values long-term wellness. In today's podcast, we will walk you through how to recognize the early signs of a vaginal yeast infection, when to seek medical help, and, most importantly, how to treat it effectively so it doesn't come back again and again. We'll help you identify the classic symptoms of a Candida infection, how to distinguish it from other vaginal issues, and share proven treatments along with easy prevention tips that fit into your daily routine. If you've ever struggled with itching or recurring discomfort but never got it fully treated, or if a loved one like your mother, sister, or aunt is silently suffering, this episode is for you. Stick around until the end to truly understand what's going on and how to take charge of your intimate health with confidence and care. So how do you know for sure that it's a yeast infection caused by Candida, and not something else? This is the most crucial part, because when you recognize the signs early and accurately, you can treat it quickly and prevent it from coming back. There are 3 classic symptoms that strongly indicate a Candida infection. If you experience all 3, there's a high chance you're dealing with a yeast issue. First, intense vaginal itching. And not just a mild discomfort, it's a deep, persistent itch that can last all day and often gets worse at night. Second, unusual vaginal discharge. This is one of the most distinctive signs. The discharge is usually thick, white, and clumpy, often compared to cottage cheese or yogurt. It may be slightly watery but mostly forms small curds or clots. Finally, a light but unpleasant odor. It's not as strong or fishy as with bacterial infections, but it's enough to make you feel uncomfortable, especially when using the restroom or changing clothes. However, just one of these symptoms alone isn't enough to confirm a yeast infection. It's best to have all 3, or better yet, get tested at a medical facility. The test is simple and quick, and it tells you exactly what you're dealing with so treatment is precise. Candida is a fungus that naturally lives in the vagina, but when the balance is disrupted, it can grow excessively and cause infection. And if you've ever thought you had a yeast infection just because your discharge looked different, you're not alone. Studies show that only about 10% of women who suspect a yeast infection actually have it. So, stay with us as we explore what causes this fungus to suddenly multiply, and how to stop it at the source. So what causes Candida, a fungus that's naturally present in the vagina, to suddenly multiply and cause an infection? The truth is, Candida exists in small amounts in every woman's body. Under normal conditions, it's kept in check by healthy bacteria and your body's immune system. When everything is balanced, you won't notice any symptoms. But once that balance is disrupted, problems begin. And what's concerning is that many everyday habits and health issues can tip the scales without you realizing it. One of the most common triggers is antibiotic use. While antibiotics fight harmful bacteria, they also wipe out the good bacteria that normally keep Candida under control, giving the fungus room to grow. If you have diabetes or unstable blood sugar levels, that's another major factor. High blood sugar creates an environment in the vagina that favors yeast overgrowth. Poor hygiene practices, like aggressive douching, using high-pressure water jets, or relying on harsh soaps, can also break down the vagina's natural defenses, making it easier for Candida to thrive. Unprotected sex and a weakened immune system, from stress, lack of sleep, or chronic illness, further increase the risk of a Candida outbreak. Understanding these triggers is the first step not only in treating the infection properly, but also in preventing it from coming back. But wait, even if you're experiencing itching, white discharge, and a mild odor, is it definitely a yeast infection? Surprisingly, the answer is, not necessarily. Clinical studies show that up to 89% of women who believe they have a yeast infection actually don't. In reality, only about 1 in 10 suspected cases turns out to be true Candida overgrowth. So what's happening in the other 9 out of 10 cases? Most of the time, it's another type of vaginal issue with similar symptoms, like bacterial vaginosis, trichomoniasis, or even hormonal imbalances during perimenopause. These conditions can all cause unusual discharge and itching. That's why self-diagnosing and self-treating is a very common and very risky mistake. It doesn't just prolong the discomfort. Using the wrong medication can disrupt the vaginal microbiome, lead to more complex infections, or even cause resistance if antifungals are misused. The key takeaway is this: uncertainty is reason enough to consult a professional. A simple gynecological exam or lab test can accurately determine the cause of your symptoms, allowing for proper treatment, faster, safer, and with less risk of recurrence. Don't let anxiety drive hasty decisions. In healthcare, understanding the root cause is always the first step to true healing. Here's the good news: if you're truly dealing with a vaginal yeast infection caused by Candida, treatment is usually very simple. In most cases, just 1 dose of fluconazole, 150 milligrams, is enough. 1 single pill. No need for a week of treatment. No vaginal suppositories. And within a few days, the itching and discharge typically improve significantly. This simplicity often leads people to think of yeast infections as minor issues. But the truth is, such quick recovery only happens when the right diagnosis meets the right treatment at the right time. If the diagnosis is wrong, or if antibiotics are misused, it can drag on and become much harder to treat. Many people also wonder, should their partner be treated? The answer is, not usually. Candida is not considered a sexually transmitted infection, so your partner doesn't need treatment in most cases. However, if you experience frequent recurrences, your doctor might recommend treating both partners to break the cycle. Most importantly, don't try to treat yourself at home just because the symptoms seem familiar. Your body is constantly changing. Each recurrence might have a different cause. Sometimes it's microbial imbalance, sometimes it's drug resistance. Let a healthcare provider guide you. Getting the right treatment the first time is always faster, simpler, and far more effective than chasing a problem that's gotten out of hand. But what if you've taken the medication exactly as instructed, and after 3 to 5 days, the itching is still there? The discharge hasn't improved, or worse, it feels more uncomfortable. This is the moment to pause and reassess your treatment plan. If symptoms don't improve within 3 to 5 days, one of 3 things may be happening. You're treating the wrong condition, you have a different infection, or worse, your body may have developed resistance to the medication. That may sound alarming, and sometimes it truly is. Although a Candida yeast infection is usually straightforward, it can be mistaken for other vaginal issues like bacterial vaginosis, trichomoniasis, or even cervical infections. Treating based on guesswork wastes time and money, and may allow the condition to worsen. The second possibility, drug resistance, can happen when the fungus no longer responds to the usual antifungal treatments, especially if you've self-medicated in the past. In both scenarios, the best course of action is simple. Get tested and re-evaluated by a professional. A vaginal swab test can identify the exact cause, be it yeast, bacteria, or something else, allowing for targeted and effective treatment. Don't wait if your symptoms persist after 3 to 5 days. In women's health, delay is the enemy. Taking action early means faster recovery and long-term protection of your reproductive health. Here's a surprising fact many people overlook. 1 in every 3 women with a vaginal yeast infection gets it due to antibiotic overuse or poor blood sugar control. This explains why, even if you're using the right treatment, the problem can keep coming back if the root cause isn't addressed. Let's start with antibiotics. These drugs don't distinguish between good and bad bacteria. When you take antibiotics, even for a cold, sore throat, or minor infection, they also kill off the beneficial bacteria in your vaginal flora. That gives Candida, which is always present in small amounts, the chance to grow unchecked and cause infection. Then there's blood sugar. Women with diabetes or fluctuating glucose levels are at much higher risk. High blood sugar not only weakens the immune system but also creates an ideal environment for yeast to thrive. That's why yeast infections tend to be more stubborn and recurrent in women with diabetes or insulin resistance. So, self-medicating with antibiotics is not just unwise, it's dangerous. You might feel temporary relief, but beneath the surface, you're setting the stage for chronic imbalances, drug resistance, and recurring gynecological issues. The key takeaway here is simple. Treating the symptoms isn't enough, you need to tackle the cause. Stop using antibiotics without medical advice. Focus on balancing your overall health. Only then will your treatment results be long-lasting and truly effective. After successfully treating a yeast infection, many people assume the problem is over. But the truth is, that's only half the battle. The other half, and just as important, is preventing it from coming back. Candida has a sneaky way of returning. If you've had it once, the chances of recurrence are quite high, especially if your vaginal environment isn't properly cared for. So how do you keep things clean, balanced, and healthy down there? First, make sure to keep the area clean and dry. The vaginal area is naturally moist, so if you don't dry thoroughly after showering, using the restroom, or sweating, excess moisture can create the perfect breeding ground for yeast. Second, never spray water directly into the vagina or use your hands to scrub the inside. The vagina has a natural self-cleaning mechanism thanks to beneficial bacteria. Overwashing disrupts this balance and weakens its defenses. Third, avoid overusing feminine hygiene products, especially those with strong scents or harsh chemicals. These can irritate the sensitive vaginal tissue and disturb the pH balance, doing more harm than good. Here's a simple but powerful tip. Eat yogurt daily, preferably plain, unsweetened yogurt. It contains probiotics that help restore and maintain healthy gut and vaginal flora, which in turn suppresses yeast growth. Also, avoid tight-fitting underwear made from synthetic fabrics like nylon. Instead, opt for breathable, moisture-wicking cotton, and change your underwear regularly, especially after exercising or sweating. Finally, after any treatment course, it's wise to take probiotics or use vaginal suppositories to help restore a healthy microbial environment. These products strengthen your natural defenses and reduce the risk of another outbreak. Caring for your intimate health isn't just about avoiding infections, it's about respecting your body, preserving your reproductive health, and living with confidence every single day. So you've finished the treatment. The itching is gone. Discharge looks normal again. You think it's over, right? But the truth is, the post-treatment phase is when your care truly matters most. If you've had a Candida infection once, the door is always slightly open for it to return, especially if your natural defenses haven't fully recovered. And once it recurs, the likelihood of repeated infections increases significantly. That's why it's not just about getting rid of the infection, but keeping it from coming back. At this stage, it's essential to strengthen your body's natural defenses with simple but impactful habits. Start by replenishing healthy bacteria. Probiotic supplements, especially those containing lactobacillus, are highly beneficial. They help restore vaginal pH balance and suppress Candida overgrowth. Vaginal suppositories may also be used, as recommended by your doctor. Next, focus on building a healthy lifestyle. Eat more vegetables and plain yogurt, stay hydrated, sleep well, and reduce stress. These habits support not only vaginal health but your overall immune system, your first line of defense against reinfection. Also, stay alert to early warning signs. A bit of prolonged itching, changes in discharge, or an unfamiliar odor should prompt a quick checkup. The earlier you detect an issue, the easier it is to treat. Remember, caring for your intimate health isn't a one-time fix, it's a continuous journey. One that shows self-respect, empowers your reproductive wellness, and allows you to move through every stage of life with confidence and strength. Dear listener, taking care of your intimate health is not a luxury, and it's not something you only do when problems arise. It's an essential part of your overall well-being, physically, mentally, and reproductively. In today's podcast, we explored key points together: how to recognize early signs of Candida yeast infections, what causes them to flare up, why some treatments fail, and most importantly, how to prevent recurrence with practical, everyday habits. The biggest takeaway from this episode is simple yet powerful: know your body, and act at the right time. No matter your age or experience, This knowledge empowers you to take control of your vaginal health with clarity and confidence. If you found this episode helpful, please support Health First 365 by subscribing to the channel and sharing this podcast with friends, family, or any woman who may be silently struggling with intimate health issues. Let's bring reliable medical knowledge closer to the community. Your health is our priority. Thank you for listening all the way through. We'll see you in the next episode, where every minute brings you closer to a healthier, more empowered life.